I'm Mary Hatfield, and today I'm going to be presenting to you on diabetes mellitus type 2 and the assessment of that. So, first of all, we're going to just start going ahead and doing a full comprehensive health history. So we're going to include things like allergies, surgeries, medications, diagnosis, get that baseline info. Then we're going to move on to the family history. You're going to look at things like, history of heart disease, history of hypertension, history of diabetes. Then you're going to move on to the physical assessment. We're going to do like a head to toe, get some vitals, BMI, eye exam. Take a look at that skin. Do not forget the feet, because you want to assess, are they feeling things in the feet? Do they have any foot ulcerations? Do they have any redness in there? So you want to look at the feet especially. You want to do an oral exam. You want to look at the neuro exam. You're assessing for DTRs. So you're doing the vibratory and sensory exam using the monofilaments. And then we're going to do an assessment of their signs and symptoms. So you're going to be looking at the symptoms of the diagnosis if they've had the diagnosis of diabetes already. So and then we're going to look at first signs and symptoms of hyperglycemia and also signs and symptoms of hypoglycemia. We're looking at things like frequency, timing, severity, and resolution of symptoms. Then we're going to look at blood glucose, get those results, and then we're going to look at complications. Do they have those foot ulcers? Do they have the neuropathy in the hands and feet? Are they having any trouble with their vision, like blurry vision? Are they having recurrent UTIs or other infections that are just hard to heal? Are they having any trouble with their libido? GI issues like nausea, vomiting, diarrhea? Have they ever been diagnosed with peripheral vascular disease? And is that accompanied with the claudication, which is just the pain in the legs? So then we're going to move on to labs. So we're going to look at their A1C, and that A1C is an average over the course of 3 months, and we want that to be below like 5.7. And then we're going to look at fasting lipid profile, and then urinalysis. We're going to be looking for proteins in the urine. We're going to probably do a CBC just in case they're having any infection. We're going to look at that serum creatinine and also look at that the heart function with an ECG. Then we're going to assess their knowledge, their level of understanding with that diagnosis. We might even do a mini mental status exam or assessment just to see kind of where they are there, and then assess the patient's current self-management ability. Are they managing that disease on their own? And then the willingness to adhere to their medication and diet and exercise regimen. So, and then we're gonna assess for any kind of referral needs. If they're having those foot ulcerations, do we need to send them to the podiatrist? Are they having trouble managing those sugars? Do we need to send them to the dietitian? Also, there's diabetes educators, and then the ophthalmologist as well if they're having blurry vision. So that is assessment on diabetes mellitus type 2.
Hi, I'm Kirby, and I'm going to be doing diagnosis of diabetes type 2. So there are a couple labs we're going to get. One is the fasting plasma glucose. For a diabetic, it's going to be 126 milligrams per deciliter or higher. This is our pre-diabetic level, 100 to 125 milligrams per deciliter. And then we're also going to do an oral glucose tolerance test. That is going to be 200 milligrams per deciliter with a 75 gram oral glucose thing you drink, basically. 140 to 199, 2 hours later is pre-diabetic. Random blood glucose level is going to be equal to or greater than 200 milligrams per deciliter with symptomatic hyperglycemia. And then hemoglobin A1C, we're going to have it equal to or greater than 6.5%. 5.7 to 6.4 is going to be pre-diabetic levels. And then urine albumin level is going to show microalbuminuria, 30 to 300 milligrams per deciliter. And then my diagnosis, my NANDA diagnosis, is ineffective health maintenance related to hyperglycemic levels as evidenced by fasting plasma glucose level test result of 200 milligrams per deciliter. Blood sugar is 500 milligrams per deciliter. Better get on it. Slow healing wounds or sores, presence of ketones in the urine, polyuria, polydipsia, blurred vision, neuropathy, retinopathy, recurrent UTI, and the patient is on dialysis. Thank you.
Hi, I'm Chantal. I will be going over the planning and goals for a patient that's been diagnosed with type 2 diabetes. First and foremost, the regular monitoring of blood glucose levels should be a main goal, priority. Regular monitoring glucose levels to ensure that they are within target range. Next would be a healthy eating plan. So following a healthy eating plan that is tailored to their individual needs and preferences, cultural preferences as well. Regular physical activity would be a goal. You should engage in regular activity to help manage blood glucose levels and improve overall health. Exercise can also help with weight management, which is important for managing type 2 diabetes. Next would be a goal of medication management. You may need to help take medications to manage your blood glucose levels, which includes oral or injections. And then regular checkups or screenings. So you should have regular checkups with healthcare providers to monitor their blood glucose levels and overall health and any complications of diabetes. And then of course we have lifestyle modifications. You should make lifestyle modifications such as quitting smoking as a goal, reducing alcohol consumption, and manage stress. All of those, we will talk about how to implement them next. So to go ahead and implement those, that planning and goals that we talked about, as far as education on healthy eating and carb counting, you can work with a dietitian to plan meals and create a meal plan that balances carbohydrates, proteins, and fats that take into account the patient's cultural and personal preferences.
Also, regular exercise is important. Making sure that you are trying to lose weight as well, because a lot of our patients with diabetes are going to be a little bit overweight.
And one of the other things we need to do is educate on diabetes medication and insulin therapy administration. So what we're going to do is talk to them about using a glucosometer at home for self-monitoring their own blood glucose levels so that they can give appropriate amounts of medication to themselves. And then we're gonna educate them on how to actually administer those medications and whether they're gonna take like an oral medication or an insulin injection, and which kinds to administer at which times. So,
yeah. So make sure we do the sliding scale insulin education and administration, where to get supplies, and self-management of things like foot ulcers and self-assessment of things like that as well.
And so for the evaluation portion, we're basically, they're gonna come back and you're gonna monitor to see if they've been able to manage those A1C levels as well as their blood glucose levels. Are they in an acceptable range? Are they responding to that medication therapy? So, and that's all we have.